Hello there. Thanks for joining me today this lovely Friday in Southern California. My name is Julie Hirschberg. I am the owner of Reactive Physical Therapy and Wellness, a place for people with neurologic disorders to recover activity. That's actually where our name comes from. And I am so excited to join you today to really almost do like a little mini course as an introduction to functional movement disorders. So let me tell you why I'm doing this. I don't know if you've heard this before from a patient, but I hear this a lot. I think a lot of neurologic therapists do. They say, I can't believe I just found you. You're the first person that's heard of this diagnosis or understands this diagnosis. And I'm happy the person has found someone, but I also gets me really fired up because how could you have been through the whole healthcare system, sometimes 10 different providers, and no one familiar with your condition? Or even worse, told you it was all in your head. And this happens a lot in functional movement disorders and it's not okay. So I have been on this mission for the last couple of years to really educate physical therapists, OTs, speech therapists about functional movement disorders. You've heard me in some of these live videos do it, but rarely have I done just a basic introduction to it for therapists to really know what it is, just the basics. So that's what we're going to do today. And I really want to encourage you to share it with your colleagues, share it with students, share it with friends. Help me get the word out really about functional movement disorders so that we don't have people coming to us saying, I can't believe you're the only person that knows what this is. So please share this video and thank you for being here, thank you for listening. I really appreciate it. So we're going to talk basics, as I said. Oh, by the way, somebody's sending me a happy birthday. Thank you, Amy. It is my birthday and I'm going live on my birthday doing what I love. Today we're going to talk about functional movement disorders basics. As I said, what is it, what can cause it, how do we know if somebody has it, how do we explain the disorder? How do we even understand it? And some simple ideas to get started with therapy. So, this isn't a super deep dive. This isn't a whole course. We have a mini course on this. We have a weekend course on this to go deeper. This is the basics. So, I'm going to encourage a lot of my students. In fact, I might even send them this video. Waldo, here, you're here, Waldo. So I'm sending you this video because we don't get to talk about this in school. So let's start with the basics. What is a functional movement disorder? A functional movement disorder is a movement disorder first. So it's tremor, it's dystonia, it's myoclonus. It may be combined with paralysis or abnormal gait disorder. So it's a movement disorder. And it's characterized by a pattern of movement that's involuntary. So it's not made up or anything like that, but it's involuntary, but it's a learned habitual movement pattern. What we know about it is that it's driven by abnormal self directed attention. And it's not due to an isolated nervous system issue. So, this is what we talk about in my neuropathology class at USC all the time, like a very specific point lesion at one point in the nervous system. It's due to functional conductivity. That's where the word comes for function. So, that's the basics in a nutshell. What is it? What it might look like. So you might see somebody come in with a tremor, with dystonia, with some weakness, with myoclonus, and it doesn't quite fit a typical pattern that you see. This is when you start to question it. So, number two is what causes it. And this we don't know completely. What the literature has shown is that, again, not an isolated lesion, but that this could come with a neurologic disorder. So it happens to be more common in other movement disorders like Parkinson's disease. So it could come along with another neurologic disorder. There's often some sort of triggering event. So there was a really nice article recently that actually looked at surgery as a potential triggering event, injuries as triggering events, concussions as triggering events. Sometimes there is an accumulation of events that occur, um, and these may kind of lead to the functional movement disorder happening. Now, it used to be thought, and in fact, functional movement disorders were called psychogenic movement disorders before, or conversion disorder, or hysteria. It was thought that these were purely psychological. Now, the literature does show that things like adverse childhood experience can can be a clear risk factor, but it's quite variable and it's not in every person with a functional movement disorder. It's not consistently found. This is not held up as was thought across the history. Also, personality traits like that has also not been found to be a specific predictive factor. So, um, we don't know what causes it. We do know that you could have physical injury, trauma, accumulation, surgery, a neurologic disorder. All of these things might contribute to it occurring. And it makes it difficult as therapists because we often have to tease this out. Tease out the neurologic disorder, tease out the functional movement disorder. Okay, and now I want to tell you how we do that as a therapist. So, how do we know if someone has this? How do we screen for it? And again, this is not something that we talk a lot about in school. So, we first really listen and listen to that person's story. Some of the things that are very typical: onset at a very precise moment in time, out of nowhere, abruptly, a waxing and waning course, and maybe even complete remission at some times, or a temporary remission, a change in the nature of the movement over time. So maybe the dystonia starts in one place and then it's in another, or the tremor or the myoclonus. So kind of migration throughout the body. That there's certain triggering events that may cause the movements. Um, and so those pieces in your subjective screen may help you down this path for functional movement disorder. And then I like to think of a specific couple of questions that I look at or that I ask about, and then we do. So one is look at variability in the movement. And the entrainment test with tremor, so looking at variability in the amplitude and the frequency of the tremor is an example. And then, so I ask, is the movement variable? Is it distractible? Does it change with dual test? Does it change when we change attention? Because attention is part of the disorder. So those would be very positive signs of a functional movement disorder. By the way, there I do have a download for differential diagnosis and movement disorder, and it has a whole section on functional movement disorder. So if you want to dive in, you can grab that download. I'll put a link in the chat. Okay, so that's how we would screen for it. Next up is how do we talk about it? How do we explain it? Especially when a person may also have been told this is in their head. They've been told this is a psychological disorder. And so I think one of the most important things is to very much listen to the person's story and very much validate that it's a very real disorder. It doesn't fit neatly in the boxes of other neurologic disorders, which I think gives all of us in the neuro world, it gives us trouble because it doesn't fit in a box. But that doesn't mean it's made up or not real. It's very real, and it's quite common actually. And I really like to talk about that it is a connectivity issue in the brain. So some people use the software hardware analogy of like a computer. So a lot of neurologic disorders are hardware problems. So you see a lesion, you see a degradation of neurons in the substantia nigra and Parkinson's, for example. So you see a very specific hardware problem. Often those things cause software problems, right? So in a functional movement disorder, it's a software problem. It's why it might not show up on an MRI, but would show up on a functional MRI because the connection is impaired. I often like to share with people some of the studies where they show functional MRI imaging and show that that connectivity is different in a functional movement disorder. That is so helpful because it leads us right into treatment. So this is the next little tip here is how to get started in treatment. And the very, initial step is leading with some of their understanding of the diagnosis and your understanding and talking about, what is your understanding and what do you think is causing this diagnosis? And here's what I understand about functional movement disorders is a connectivity issue. But that listening, building the relationship with the person is so important. And then we have several frameworks that we use a lot of in functional movement disorders, but one of them is a pie chart that looks at some of the underlying neurological connection issues like the autonomic nervous system, the sensory system, the motor system, some of the underlying physical impairments that may have contributed to this in the first place. And then the environment, the context, the psychosocial. So we look at all of those pieces, investigate all of them, and then intervene. So if the autonomic piece of the pie is really big, that's where we start. So we might start with some nervous system calming. We might start with autonomic regulation activities. One of my favorites is a grounding activity. I'll put a link because you can download our grounding activity too. So that's a really great place to start if autonomic comes out for someone. It's not for everyone. So that's why this is not like a cookbook of any sort. Not everybody has deficits in the same way, but autonomic symptoms and sensory systems and that sensory motor integration are often really big culprits. And we can train those in PT and OT and speech. So a lot of hope for recovery for a person with a functional movement disorders. So that was a very basic intro to functional movement disorders. What is it? What causes it? How do we know if someone has it? How do we maybe explain what the disorder is? And just very simple ideas to get started in therapy. And again, please share this with other people. This is not stuff that we typically teach in school, and we should and we will. But we really want to be able to help and not harm people with functional movement disorders. And when we don't understand it well, I would say we end up doing more harm than good. So I hope you found this video helpful. I love talking about this particular topic. And please let me know if you have any questions. And I look forward to hearing from you and continuing these discussions and conversations in the future. Have a great day, a wonderful weekend, and I'll see you next week.